Thank you, Mr. Speaker, and thank you to the gentleman for yielding. I rise today in support of H.R. 5102, the Substance Use Disorder Workforce Loan Repayment Act. As families at home know too well, our country is in the midst of a devastating public health crisis. The opioid epidemic claims more than 115 lives every day. And in 2016 alone, more than 42,000 people lost their lives to opioid-related drug overdoses, and more than 64,000 died from drug overdoses overall. Every one of those lives lost left heartbroken families, friends, and communities. Part of addressing this epidemic is making sure that everyone who is looking for help can access effective treatment and ongoing management of this chronic condition. To date, however, we have failed in this endeavor. The Surgeon General's 2016 report on addiction estimates that only 10% of Americans living with substance use disorder receive any treatment. There are a range of barriers to accessing treatment, but one of the most significant is a shortage in the workforce needed to provide it. Between the rising cost of education, low salaries, and a high burnout rate from the stressful and emotional work, it is a struggle to attract new people to the treatment field and keep those who work in it long-term. In my district, I have heard time and again from families and providers that there simply aren't enough treatment specialists available to help the growing number of people who desperately need treatment. I've heard from families who've tried to get their loved ones into treatment and lost them to an overdose before they were able to get them the help they needed. No one should have to live with that heartbreak. That is why I authored this legislation with my esteemed colleague from Kentucky, Chairman Hal Rogers. This bill will help recruit and retain more treatment experts by offering up to $250,000 in student loan repayment for participants who agree to work in the treatment field for up to 6 years. The program will cover professionals who represent the whole spectrum of treatment, from physicians to nurses to social workers to recovery coaches, promoting the kind of wraparound treatment approach that we know gives patients the best chance for success. And by providing a portion of loan repayment for each year of service, the program encourages treatment professionals to stay in the field longer. Further, this legislation is designed to send help where it is needed the most. Participants in the program must work in a county or municipality with either a shortage of mental health professionals or an above-average rate of overdose deaths. Whether you live in an urban or rural area, from Massachusetts to Kentucky, more need will mean more available treatment. I'd like to thank Chairman Rogers for his partnership on this important legislation and the other original co-sponsors, as well as the Energy and Commerce Committee and their staff for their work throughout this process. We need to make significant long-term investments in the professionals who make recovery possible. People's lives depend on it. I urge my colleagues to vote in favor of this legislation, and I yield back.
Gentlelady yields. The gentleman from Oregon.